Good afternoon, everyone. Today we are here at Faqih University Hospital for the Ask FUH session. And with me we have Dr. Ahmed Hassoun. He is a consultant endocrinologist and clinical professor at the Biomedical College. Welcome, Dr. Ahmed.
Thank you.
As we know, today we have World Diabetes Day, and the theme for the day is Education to Protect Tomorrow. So we have Dr. Ahmed with us, who is gonna give us more information about how we manage diabetes and related conditions here. So welcome, Dr. Ahmed.
Thank you.
We have lots of questions from our viewers, and I am getting many queries related to how do we treat diabetes, how we manage diabetes, because the disease burden here in UAE is extremely high when it comes to diabetes. So what are the causes of diabetes, Dr. Ahmed, if you can help us understand?
Sure. That's a good question, actually. That's a good introduction to the subject, because we need to know the types of diabetes. And we have known to have 4 types of diabetes.
Right.
Type 1, type 2, gestational diabetes, and a group of others, we call them others together. They are in the 4th category. Type 1 is the one that we have deficiency of insulin, complete deficiency of insulin, that the patient usually is a younger person and developed autoimmune antibodies attacking the pancreas, leading to deficiency of the insulin secreting cells and reduction of insulin to almost absolutely nothing there. So in these people, for sure they need to have insulin for treatment. Now, the more common one is not type 1. Actually, type 2 is the more common one, and it's common in the world as well as common in UAE as well in the Gulf. And it is more than 90% of the prevalence is due to the type 2. Now, type 2 is a little bit different in a way that there should be also some deficiency, but it's a relative deficiency of insulin relative to the sugar that is elevated and not enough insulin to cover. But there is some insulin in the body that will take care of it. Gestational diabetes, on the other hand, is in a way somewhat similar to the type 2 diabetes. Again, there is some relative deficiency compared to the level of sugar, leading during pregnancy, because of insulin resistance is increasing, to develop diabetes. Now, the other group have many small, infrequent causes. Sometimes are genetic, which is very strongly inherited. And there are others like diseases due to cortisone, steroids use, and sometimes pancreatic disease, and very few uncommon diseases.
Right. So, doctor, there are 4 types of diabetes you already mentioned to us, and we also know that many patients, they start taking insulin later in their lives. Right. So what are the steps to follow before we start taking insulin?
Exactly. Well, as I said earlier, we have deficiency of insulin, for example, in the type 1 I'm talking about. So in type 1, we have complete deficiency, so they have to be treated on insulin. Okay. So that's completely different story. But you're talking about more of type 2. In type 2, usually we start with in addition to lifestyle and exercise and diet, we usually start with oral agents, medication. And if that's not achieving what the target that we would like it to be, which is a good control of sugar, then sometimes we have to add not necessarily only insulin, but sometimes injectable new drugs, injectables also like insulin, and sometimes we need to give insulin as well.
Okay, I get you, doctor. You also mentioned about type 2 diabetes to us, and which is more towards the lifestyle related.
Right.
So what are the foods that should be avoided in order to not raise the blood sugar levels? And what are the best foods you can also recommend for our patients?
Well, in general, let's talk about in general to prevent people from getting type 2, as we said, the lifestyle and diet. So the diet should be a healthy diet.
Yeah.
And we have to, be careful about the calories we are taking during the day so that we don't have excess calorie that will build up in our body to have more of obesity and overweight, predispose us to diabetes. So that's in a prevention way. But if somebody have diabetes, especially we're talking about type 2, then these people have to be careful about the selection of the food choices. So they have to avoid really the sugar that is really sweet and sugars, clear sugars there. We call them refined carbohydrates. Okay. And also the carbohydrates that are high in glycemic index, means if you take a little of them, quickly they go in the blood, and that's what we call high glycemic index. So a complex carbohydrate is better. And also trying to avoid the saturated fat, which is in general good for the health, to avoid these things, as well as trans fat. And in general, a lot of vegetables are good. Fruits in moderation is good because fruit also can increase the sugar if not taken in a careful way. In addition to that, all the, let's say, low fat, meat, for example, the grilled fish especially is good. Nuts are good actually. We always recommend to our patients nuts because some of them especially are less in carbohydrate and more in protein and fat. Plant fats in general is recommended. And as you know, avocado is something like that, an example. The nuts I talked earlier, and also you have the olives and olive oil are excellent thing. In addition, for the meat, for example, the fish is a good thing to consume.
So there are lots of good food the patients can take.
We are lucky.
Yeah, that's true, doctor. So if a person adheres to a healthy lifestyle and diet, do you think that diabetes can be cured?
Right. And again, as I said earlier, we better to prevent it from happening by doing the right thing, as you said.
Right.
But if somebody already have diabetes, and just to remind our people who are listening to us that we need to be careful about screening, our people here, family, to diagnose early diabetes or even pre-diabetes. So if we diagnose diabetes early, we don't need to wait for a long time to treat them and to correct as we're trying to cure them, for example. There is no cure, but there is control, and we call remission of diabetes. So if somebody is early diagnosed, type 2 we're talking about, and started on a lifestyle diet and exercise, achieving good result with weight reduction, and we expect that by reducing about 10% of the weight, 10 to 15% of the weight, with a lifestyle and sometimes with medication as well, that will reverse, to a remission state of diabetes. But very important, when you lose this weight, you're fine, right? You're in a remission. But if you again start gaining weight, you will go back to the same old story to have diabetes again. Because
healthy lifestyle, managing your weight.
Exactly. Yeah.
Okay, so I can understand that. So there is any definitive cure for diabetes?
If we talk about cure, basically, as we talked earlier about the issue of the cause is deficiency of insulin.
Right.
So when you talk about cure, you have to replace that deficiency. So in type 1, there's a lot of studies and research going on in the field of how to replace the beta cells which secrete insulin, or how to increase them, and maybe using stem cells in the treatment of that. Still, we are in the research time. We still did not reach to a way that we can deliver this thing safely. So people are working into getting the beta cells that secrete insulin, put them in a way in the body that will be protected from, again, the autoimmune process that will attack them and will destroy these new cells. But this is still, as I said, it's in a matter of just research. So people are working hard into getting this cure, but until now, I would say we are still waiting for the final cure for that.
Okay, so we are still waiting for the final cure. So doctor, are there any modern techniques or technologies to treat diabetes, or do you use anything in your clinical practice here?
Right. Well, that's a good question. I would like to say that we are lucky in United Arab Emirates as well as in Faqih University Hospital, because we have everything available in the Western, countries in the US and the West world, and we are having it here. And actually, one example is one of the drugs just approved a few months ago in the United States, not even in Europe. UAE brought it, and we have it available in UAE and also in our hospital. We probably were one of the first hospital to get it here. That's for treatment of type 2 diabetes, basically. So in a way, the technology is advancing. The technology of medication, we have plenty of choices. I remember when I was in the US, we have probably only 2. A third one came before I joined, coming back from the US, were available of oral agent and injectables. Now we have 11 and 12 classes of drugs to treat diabetes. So we are lucky we have these advances in the world, but we are lucky that we have it in UAE and in Faqih University. That's for treatment. Injectables, again, as I said, there's one of the new injectables other than insulin are in the world available, and now we have it here in UAE, and that's available in Faqih University Hospital. In addition to that, more importantly, also about monitoring the sugars, because that's an advances also in how to monitor the blood glucose. We have also in Faqih different ways of using, a sensor that will look into the sugar, and that sugar can be traced and see even graphing them during the day. Very much advanced in a way, helping the patient about what's happening with their food, for example, so they can learn during getting this sensors on their body. And we have insulin pumps, which also are advanced. We are using one of the highest level of advanced insulin pump that have some, in a way, automatic secretion of insulin to correct the sugar if it is high, working together with the sensor. So the sensor give a message to the pump will reply by correcting the sugar. So we have everything available in the Western world, and the US is available here, available in Faqih University Hospital.
Okay, this is good to know, doctor.
Yeah.
And doctor, do you have any recommendation or any advice to the audiences, those who are listening to us today?
I think it's an important thing. And again, one of the, as you mentioned earlier, the theme of this year, is education to protect for tomorrow, right?
Right.
So what we need to have access, everybody to go to get educated about diabetes, and more importantly, how to prevent it from happening. Really, this is what should be the message. And preventing diabetes, especially we're talking about type 2, that affected by lifestyle, is to start from the beginning. First of all, go and screen yourself and your family members. Especially we recommend here in UAE for type 2, 30 years and above. Even if they don't have any risk factor, they should go and be screened for diabetes. And if they don't have diabetes, they might have pre-diabetes. If they have pre-diabetes, that's even easier to diagnose early and reverse it to normal rather than progressing to diabetes. So I would say prevention is very important, and that's what we should look for. And if the people having diabetes being diagnosed recently, let's be aggressive on that and do, as we talked earlier, about trying to have a remission, and not a cure, but controlling and remission of diabetes by doing the right thing with the lifestyle, in addition to the medication that will help. Now we are lucky to have medication that can help us in reducing the weight, and it's available in UAE and available in our hospital here.
Okay, that's good to know, doctor, and this is a very useful advice for everyone, that prevention, screening, and managing your diabetes and the sugar levels. So that's it from our side. Thank you so much. Signing off today, myself Sapana. With me is Dr. Ahmed Hassoun. Thank you so much and have a nice day today.
Thank you very much.
Thank you, doctor. Thank
Bye-bye.
you.